Peace be to all. Assalamu alaikum. Happy Friday. Juma Mubarak here. I wanted to talk to you guys about my adventures in mentoring. I am a physician assistant. Now some refer to us as physician associates. My background is also in health education, so it's my doctorate. So I have students follow me who are pre-PA students. They're trying to get into physician assistant school. And some of them are also pre-med students. For the pre-med students, they're on a markedly different track, but in terms of patient exposure, I try to give them a good shadowing experience because they have not gotten into medical school yet, so it's important for them. Patient interaction, the recognition of some of the various manifestations of different pathologies, how to work as a team. So I think it's an important thing for them. And I always refer them to actual doctors. My supervising physician who's actually been through medical school, so they can talk about that. And somebody like Dr. Andre Pineset. You can do a lot of good for your students or those who you are your mentees as a mentor. It's important. One of the things I stress upon with them, with the folks who are following me, is professional dress, professional courtesy. I work with predominantly African Americans, black folks, my people, in the inner city. So when you're older, there's various idiosyncrasies that we have. We call our older people Mr. and Miss, instead of girl or grandma, or staying away from pet names, even though many of them may refer to you by a pet name. I got women who call, "Hey, sweetie, how you doing?" I'm not Mr. Abdul-Malik to them. I'm young enough to be their son, and that's okay. It's part of our culture. But I hope that I'm giving these students a valuable learning experience. If anything, they can at least say, "Yeah, I interacted with patients. I learned, some very rudimentary concepts of a physical exam, history taking." That's what I used to teach when I was an adjunct college professor many years ago. How to use a reflex hammer or a tuning fork or the stethoscope. So hopefully it'll give them an edge on their competitors. Getting into a PA school and medical schools is very competitive. There's thousands and thousands of applicants for just 100 spots at best. Okay, guys, that's it for now. If you have any interest in being a PA or a health educator, or even if you want to be a doctor and you want some advice, I did take the MCATs many, many years ago. I can give you some advice, or I can even lead you to people who are far more knowledgeable than me, like doctors. All right, that's it for now. I wish you guys the best of success in your positive endeavors. Peace.